Hello and good afternoon. Thank you for joining us here on UBC TV, broadcasting live from Nile Avenue. My name is Wadulo Arnold, and we're bringing to you the lunchtime news this 28th day of May 2021. Now straight into the head story. The Ministry of Health is calling for vigilance as the country goes through the second wave of COVID-19. We were telling you about that yesterday at the joint bulletin. Now the new strain is much more aggressive than the first variant. Now, as Ivan Kawa reports, vaccines have been withdrawn in districts with poor vaccination levels to help the vaccination of people in densely populated areas. These are the details.
The new variant of COVID-19 in Uganda has amplified the Ministry of Health statistics. By press time, Uganda had recorded 44,594 cases of COVID-19, 194 active cases, 43,401 recoveries, and 361 people dead.
It's obvious from our statistics that the number of cases and deaths are increasing, as you have seen from above. Our data shows that the most affected group this time, the age group, is 20 to 39 years old.
The harshness of the condition of the second wave is higher compared to the first wave. The second wave has taken 10 days to shoot the highest level compared to the first variant that took 3 to 4 months.
That can explain why some of the variants we are having now are more infective, more aggressive. Even when they get into the body, they cause severe disease.
The rise of COVID-19 is attributed to complacency in adhering to the standard operation procedures.
If you all know about the parties which are going on with so many numbers, over 1,000, you all know about what is happening in funerals, public transport, including border borders where you find 3 people on a border without even masks. So if this situation, or if these malpractices don't change, the epidemic will get worse.
Supermarkets and banks are reportedly trying to enforce the guidelines. Districts that have reported the highest number of infections in 14 days include Kampala, Wakiso, Gulu, Amuru, Moroto, Arua, Mbale, Masaka, Oyam and Kalungu.
Some of these differences are largely because of the fact that in the first wave we were dealing with a more or less an imported epidemic. Right now the epidemic is amongst us.
The new strain of COVID-19 has increased in schools, and in just 1 week alone, the Ministry of Health reports that 803 cases and 1 death have been reported in 29 schools. And as for the new strain allegedly reported by Chambogo University students, the Ministry of Health confirms that investigations are ongoing.
The administration itself really told us that they have some students with symptoms and teachers, so we are working with the administration there to support them.
Meanwhile, officials from the national medical stores are withdrawing vaccines from districts that have not fully utilized them. These will be used to vaccinate people in Kampala, where the infection rate is reported high. Those coming into the country will be subject to a mandatory PCR test, though those whose countries of origin have achieved 50% of vaccination will not be subject to the test if they produce a valid vaccination certificate.
But we try as much as possible to believe that we will not have those forgeries. Of course, we cannot rule out also the forgeries.
Ugandans who received their first jabs are advised to go for the second jab of the vaccination. Ivan Kahwa, UBC News in Kampala.
Now, to that same note, downtown Kampala is one of the most non-compliant areas to the COVID-19 standard operating procedures, according to the Health Analytical Report. Now, although government had initially given a window to business outlets like shopping malls and arcades to resume operations after a month of total shutdown with stringent SOPs, but adherence is now at its lowest. These are the details.
But the more we create confusion in the city, the more it proves that we are actually not ready to operate.
In July 2020, government relaxed the COVID-19 standard operating procedures to a few business entities, which orchestrated the gradual opening of the economy. In downtown Kampala, business arcades and malls were among those given the green light to resume operations, but with terms and conditions.
We were given guidelines like how to keep distance, washing hands, and wearing masks. But as time goes on, people are now reacting.
However, month down the road, the story is worrying as many city dwellers seem not to be bothered to the use of their protective gears in the fight against the deadly COVID-19 pandemic.
It's upon our lives. Like some of us, our bodies are of high immunity, unlike that of Europeans. But also COVID has hit us hard.
I cannot tell the president to impose a lockdown again, but seriously, our people are big-headed.
This is Lumu Street, one of the busiest business access routes to the city center of Kampala. Here, many city dwellers try to get through the city center in search for their daily survival. However, the worst scenario seems to be that COVID-19 standard operating procedures are on a holiday, as you rarely see people putting on their face masks or even washing their hands as they try to access some of the city arcades and shopping malls.
But why has the zeal and guard against COVID-19 in such places kept on lowering down? This is a question we posed to Mpaji Sulaiman, one of the local leaders in the Association of Kampala Arcade Operators.
As we are told about the pandemic, that people are going to die, so many people are going to be infected, these people are now reacting because they have not seen it as people dying in masses. Like in Kampala here or in Uganda, they have not died like people who died in Italy.
Besides malls and arcades, similar flout of COVID-19 standard operating procedures such as hand washing, putting on face masks and social distancing are witnessed in the transport and market sector.
On our stages we have water, as you see in the background. And that is a very big problem. We tell them that before you enter our taxis, you first wash your hands. They refuse.
The challenge is that at first, people were very scared because the virus had claimed many lives, not only in Uganda, but in the entire world.
They have this saying that there is no corona. Those ones you cannot throw them away from from other people. You cannot deny their chances of entering the market.
If we do the same thing today, arrest people, take them to courts of law, like we're following there, and people are not learning that COVID is real. So I think there is need to not only enforce these guidelines, but also to educate the people. That is not the work of the police, to educate the public about these dangers.
Although the general public, especially the business industry, carries the highest percentage of blame for the surging COVID-19 cases and death, to others, the enforcement agencies have no justification for their indiscriminate standard operating procedure enforcement.
We have a bar around Shell Mengo. It is nearby Lunguja police station, but the bar is always operating freely until morning.
The fact that police officers pass nearby doesn't mean the bars could be them. Or maybe they are theirs, I cannot know. But what I can say is that we have at all times made sure that we enforce, and officers who have shown negligence, whenever we get information, they are dealt with in accordance with the law.
Irregardless of who the messenger can be, the reality remains that there is no angel to spread the gospel against COVID-19, but rather a spirited fight against the visibility of mass graves should and must be a responsibility of me and you. Robert Onyango, Kampala.
Now, just to emphasize this, in just 10 days, COVID-19 numbers have risen to that it took us 3 months to reach in the first wave. That means the second wave is actually serious. So ladies and gentlemen, please do abide by the standard operating procedures. Wash your hands, wear a face mask, and maintain a social distance. Now, in other news, Ministry of Health has tasked all district leaders to ensure that they mobilize people in their respective districts to take up the COVID-19 vaccine, or else they will be withdrawn for redeployment. Ministry of Health and the World Health Organization have agreed that COVID-19 vaccines be withdrawn from districts that are underperforming to well-performing districts.
In March this year, Uganda received 2 consignments of COVID-19 AstraZeneca vaccine totaling to 964,000 doses from the Serum Institute of India through COVAX facility. Because of the limited doses of the vaccine, government prioritized beneficiary groups considered to be at high risk of contracting the disease, and these include people above 50 years, teachers, health workers, security, and people above 10 years with underlying health conditions. This first phase of the COVID-19 vaccine targets to reach at least 20% of the population, which is approximately 9 million. The World Health Organization has so far approved 6 COVID-19 vaccines, including AstraZeneca, which Uganda is administering. But what is the efficacy of this AstraZeneca vaccine?
This vaccine has been approved for use by the World Health Organization. And there are basically 3 critical components that they look at before a vaccine is approved for use in a wider population. First of all, is it safe? And what do we mean by safety? That these side effects that will occur, can the people really handle? Can they manage these side effects? Then the other critical component they look at is the quality. What processes did they follow when they are producing this vaccine? And then finally, what's known as efficacy. Now, for the COVID-19 vaccine, they put a benchmark. If we can get a product that can prevent disease in at least 50 people out of 100, that is good enough.
However, some people are still reluctant to receive the vaccine due to unknown fears.
Now, this clotting disease, which has already been, of course, even talked about in some of the media and also tried to rectify, it is a very rare condition. What do we mean by rare? In every 1 million people, only 4 of them who have received the vaccine develop what? That clotting disease. But the good news, it can be treated.
One of the questions being asked by the public is that why do some people get infected with COVID-19 even after receiving the vaccine? On this, the experts explain that the aim of the vaccine is not purely to stop infection, but rather to prevent one from getting severe form of disease.
That if I contract the COVID-19 disease now, at least I will not be admitted. I will not go to the, you've heard about the ICU. I will not go to the HDU. I will not go and start struggling to get a ventilator. As you know what happened in the past, you would have to line up to queue because the beds are already full. That is what these vaccines are trying to prevent.
If you're vaccinated, you have lower chances of death and getting severe forms of disease that may result in death compared to a person who is not vaccinated.
The controversies surrounding the COVID-19 AstraZeneca vaccine have instilled fear in the population. Now, the Ministry of Health is considering to withdraw vaccines from districts which are underutilizing them to those where the consumption is high. The low-performing districts are the regions of Karamoja, Acholi, Lango and Bunyoro.
It costed us how many months of lockdown? And we get this free, precious product that has been a breakthrough to controlling the pandemic, and we say we are disposing vaccines due to expiry. We shall not be part of that conversation as a country, and the decision has been made. We have given the districts 3 days.
Ministry of Health is sending out an official communication to all the districts, to the district leaders, to the technical leaders, to really, if they're sure they will not utilize the vaccines, recall there are some other districts, some other people who are willing to do what? To use the vaccine.
According to the National Vaccine Deployment Plan developed by the Ministry of Health, the target is to vaccinate 22 million people by 2022, which is 49.8% of the population. This first phase of the vaccination targets 9 million people, and so far 527,917 have received the first dose or both. Sandra Kahonde, Adia Nakuti, UBC News.
So many people might not be trusting the AstraZeneca vaccine, but this is a vaccine that has been widely rolled out across the globe. Yes, a few spots and tates have been recorded, but definitely the vaccine has proven to work. So ladies and gentlemen, please do get vaccinated in the nearest designated health center. Now, in other news, the Permanent Secretary in the Ministry of Health, Dr. Diana Twine, has received GenExpert's 16-module multiplexing machines for regional referral hospitals to improve access to care and quality diagnostics. The machine can diagnose 35 diseases at a go, including COVID-19, TB, HIV, among others.
Ministry of Health has received an assortment of GeneXpert machines for better management of health services and access to quality health care. The Permanent Secretary of Ministry of Health, Dr. Diana Twine, noted that the laboratory services are critical in the delivering of quality care services.
To regionalize and fully functionalize our regional laboratories so that they reach that world-class status.
Dr. Twine requested all clinicians to utilize the laboratory services and put the machines in good use.
I request the ICT team to ensure that you set up integrated data system that incorporate laboratory management system into these GeneXpert machines so that we can get data into the central level for coordination and planning purposes.
The Executive Director, Joint Medical Stores, Dr. Bildad Baguma, notes that as part of the national response to COVID-19, Joint Medical Stores have donated oxygen regulator machines.
A specialized type, unlike the normal ones which are connected to one ventilator. These regulators can connect to 3 ventilators and therefore be able to support a bigger number of people. In addition, Madam PS, we are also donating 8,000 N95 masks that we hope will also support the response.
Meanwhile, many people have turned up at the Ministry of Health to receive their COVID-19 jab as the second wave hits the country. Zahara Abigaba, UBC.
In another development, Uganda Nurses and Midwives Examinations Board has released the 2021 semester results, which were held early this year in March. The Permanent Secretary, Ministry of Education and Sports, Alex Kakoza, officiated the release of the examination results. He said that they are going to do everything possible to ensure that they improve on the quality of nurses and midwifery.
Upon your acceptance to release these results, principals of training institutions will collect the candidates' results on scheduled dates. The schedule is in accordance with the observing of COVID-19 standards operating procedures that discourage overcrowding. Acknowledgement. The Chief Guest, I wish to extend sincere appreciation to you for continued moral and financial support extended by Ministry of Education and Sports to UNIMEC. In the same regard, the board extends appreciation to you and the entire staff of Ministry of Education and Sports for ensuring continuity of learning in the training institutions amidst COVID-19 pandemic challenges.
I specifically acknowledge the tireless efforts of the Executive Secretary UNIMEP and her team. Please, let's clap for them. These people work almost day and night to make sure that the institution runs as expected.
I now take the honor on behalf of the Minister and First Lady, Minister of Education and Sports, to officially release the March 2021 semester examination results conducted by the Uganda Nurses and Midwives Examinations Board to the public. The Minister shall endeavor, therefore, to provide more resources to training institutions so that the numbers continue improving. When the numbers increase, it means that also UNIMEP requires more resources. And you recall, those who have been present here for some time, you recall that some 4 years back, the budget for UNIMEP was quite different. The quality of our nurses will greatly improve because nothing can give you the best skills or better skills than going on the work. These are people who have been on the work, who have been and are on the wards, and therefore when they come to interact with our learners, we can only expect improved quality from the nurses and midwives who are training. Accordingly, therefore, as I conclude, I want to thank the Ministry of Education and Sports team, the Ministry of Health, and other government ministries and departments who have worked tirelessly with UNIMED during the preparation and conduct of the March 2021 semester examinations. I want to acknowledge the commitment of the UNIMED board members and secretariat staff to the service of the public. I look at stakeholders from the training institutions and hospitals for supporting skills attainment.
Well, congratulations to those nurses and midwives. Now, in another development, Rotary Club of Kampala Daybreak is in the process of handing over 7 primary schools in the districts of Masaka, Chikube, Kanungu and Kakumiro, respectively. This was disclosed at the official handover of one-year club leadership tenure to the president-elect, Frederick Chitakule.
The Rotary Club of Kampala Daybreak has spearheaded a move of ensuring that the education sector, especially in the early childhood, is boosted in rural areas. The President-elect Club of Kampala Daybreak, Frederick Chitakule, says his leadership tenure is to focus more on education in rural areas.
And we have also partnered with Makerere University, and we are going to do a satellite early child development centers where we are going to do teacher training and be able to commission well-trained teachers, because the building is one thing, but what goes on in the building is actually what is very important. We are going to do economic empowerment projects around farming. We have a group of farmers in India. We're working together with the High Commission of India to get, market. Market is the challenge of all farmers across Uganda.
The club has not only been supporting education, but also led in the fight against COVID-19 pandemic by donating face masks, sanitizers in rural areas, and sensitizing the communities on the dangers of the virus.
Been able to distribute over 10,000 masks, which helped those who could not afford buying masks. This was in Katanga and Naguru. We distributed them at the start of the COVID-19.
Handing over tools of power, the outgoing president, Rotary Club of Kampala Daybreak, Jamson Kalemani, highlighted the challenges encountered during his leadership and was commended for transforming the lives of the underprivileged.
The biggest challenge, of course, has been COVID-19, because one of our objectives as Rotary is developing socially. So because of not meeting that component of social has died out, we cannot meet and encourage each other.
The function was graced by club governors, former presidents, Rotary Club of Kampala Daybreak, and club members.
For you, Frederick, the vegetables you're going to harvest will be the impact you're going to create to humanity. Cancer, HIV, malaria, diseases that affect humanity. Make sure that come rain, come sunshine, we create many zeros of this world. It is possible. It is a matter of giving yourself a commitment and say, yes, I can do it.
Deborah Namamonde, UBC News.
That takes us for a short commercial break. When we return, we'll be back with business. Stay tuned.
In chess, the small one can become the big one. It's the same here. And here too. Watch every move. Record every number so you can plan better. No matter the size of your dream, Tomorrow's success belongs to those who keep today's records clean. File your returns today.
Uganda Revenue Authority, developing Uganda together.
Echa COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
It's Freaky Friday from Airtel. Buy or gift. Buy or gift.
Get freaky too! Dial *149*10# to load a Freaky Friday bundle for you to enjoy the best offers on voice and data.
To buy a bundle for friends and family, dial *149*10*4#. Freaky Friday with Airtel. Buy or gift a bundle today. Dial *149*10# to get started. Airtel, the smartphone network.
Welcome back. You're still watching the Lunchtime News, broadcasting live from Nile Avenue here at UBC TV. Be reminded we're also streaming live on YouTube under the name tag UBC TV Television Uganda. Now, in other news, the French President Emmanuel Macron yesterday on Thursday recognized his country's role in the 1994 genocide in Rwanda, from backing a genocidal regime to ignoring warnings of the impending massacres. Now, Macron is the first French leader since 2010 to visit the East African nation, which has long accused France for complicity in killing some 800,000, mostly Tutsi Rwandans.
Et respect à vos côtés ce jour. Je viens reconnaître nos responsabilités. Mais la France a un rôle, une histoire et une responsabilité politique au Rwanda. Elle a un devoir, celui de regarder l'histoire en face et de reconnaître la part de souffrance qu'elle a infligée au peuple rwandais en faisant trop longtemps prévaloir le silence sur l'examen de la vérité.
And that brings us to the end of our lunchtime bulletin this 28th day of May. My name is Wadulo Mark Arnold. Stay tuned for more news in our subsequent bulletins. Up next is The Score. We hand you over to the sports team.